Good afternoon, everyone. My name is Brenden Hayden.
And I'm Ronald, Audette.
And we'd like to thank you for taking the time to view this informational video about our presentation at GEMS EMS Today 2019. Our topic is Examining the EMS Hospital Relationship and How to Improve. Before we talk about what we're going to talk about that day, just a quick high level. I'm a 30-year EMS professional working in both municipal, private, and hospital-based sectors. I've done EMS education, EMS leadership. A number of years ago, I got into hospital leadership and then finally have landed in healthcare system leadership, where I serve as the System Vice President for EMS for the nation's largest privately held for-profit healthcare system, comprised of over 36 hospitals in the U.S., 2 international hospitals, and within that company, my role is to develop and push out EMS strategy and better ways that we can work clinically with our EMS partners for the benefits of our patients, health systems, and our communities.
Like Brenden, I've been involved in EMS for the better part of 30 years as well. I've spent time in private, municipal-based, and also hospital-based EMS. I've spent time with education as well. I currently serve full-time as a firefighter paramedic in a local community that is in close proximity to the hospital, where I work as an EMS manager. In that role, I serve as the voice of the EMS community for hospital leadership and the voice of hospital leadership to that EMS agency.
So what we're really going to talk with you all about during the presentation is how you, as an EMS leader, can use your position and your service's importance to the community to be able to help take on new agendas and new strategies in working with hospitals. Hospitals are huge $1 billion enterprises that are designed to take care of people. And you, as an EMS professional, have some key opportunities to partner with hospitals to do lots of different things. We'll talk about operations, we'll talk about strategy. There's lots of different elements that we'll go into. We'll also talk about how to use your data, how to use that information that you have to be able to influence and move the needle in your direction with these health system administrators.
Working with EMS, folks like myself within the system focus on 3 key pillars. The operational needs of our organization and the EMS organizations that we work with, the clinical needs of our organization and the EMS organizations that we work with, as well as defining strategy and developing strategy so that we can enhance patient care working with our EMS partners.
And finally, we'll talk a little bit about innovation and how important it is for all of you to be innovating and how you can work with your hospitals to innovate in very different ways that can be mutually beneficial to your service, certainly to your patients and to your communities. And we'll close off by just focusing a little bit on that relationship and how to maintain that relationship with your healthcare leaders so that you can get what you need as a service by being a good partner as opposed to being treated as a vendor. So we look forward to seeing you at GEMS on Friday at 9 a.m. Not sure what room yet, but we're in the leadership track, so we hope that you all come down and see us. And as a final note, go Pats!